Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. Today, I want to talk about something that's been popping up over and over again in this week, and it's been this physician's scope of practice and how so many physicians will get so defensive and actually angry at other physicians for doing treatment protocols that they feel like is the best next thing for the patient. Um, Personally, I want to give my own story first, and then we'll kind of build on from there because it seems like this has been going on more and more in different fields. Um, I had a patient referred to me from a spine surgeon, and I was doing certain procedures for him, epidurals, this, that. Nothing was helping. So I decided to ask the patient, what is your plan with the spine surgeon? What are they going to do? And the patient explained to me, well, I don't know what the plan is. He hasn't really made a plan. So, as far as I know, I'm still in pain. It's like, okay, so I have this procedure for you. I think it might be beneficial. It's definitely going to help with certain things. So, why don't we go ahead and get this approved? So, he said, that sounds like a reasonable plan. Um, and this type of procedure that I had doesn't do anything, it doesn't take out any other procedure or surgery that a surgeon would have to do in the long run. But the surgeon felt otherwise. So after the procedure, this patient actually did have pain relief, and they actually also had relief of one of their biomechanical problems that I was trying to achieve. Unfortunately, it didn't fix all the problems, and the patient still had some sort of other pain and other issues. I explained to the patient that, I think this is a good sign that we took care of some of these problems. So now you can get back to your physical therapy exercises, your stretching, get back to your modalities and see what we can do to get you over the hump. He had a follow up with his surgeon, and the surgeon had come and called me actually saying, I don't want you doing these kind of procedures, especially for my patients, because you mess everything up and now I have to go fix up the mess and all this. Well, unfortunately, this patient was in the clinic with that surgeon when they were on the phone with me. So how inappropriate this is just really, really odd and interesting because you refer to someone because you need expertise in their field. Hey, what do you have to offer for this patient that I can't offer for this patient? How can you help them? Um, and you do the best of your ability. Um, and again, I know the spinal integrity, I know the structures and all that stuff. So for this specialist in orthopedic spine world not to appreciate my specialty in interventional spine world and knowing what I know about the anatomy, um, knowing what I know about my procedures, but also I need to be well versed in their procedures. They say they know the procedures that we do, but it's not always at the same level, right? They just know, oh, they just do this, they do that, and then they come back to us for surgery, and that's all we see. Well, that's not necessarily a fair take, and I'll get more into this as I go down. Um, the biggest thing that I've noticed from this is that we don't have the ability to go back and tell these patients why we did what we did. We can't give them our knowledge and our experience in that of the field and what we've seen down the road and what we're trying to accomplish for the patient. Sometimes these patients just want a quick relief and a quick fix, and there are no quick fixes. There are no easy surgeries. None of this is easy. None of this is absolutely the best choice. We use each other in support of one another to help one another out. It's under my impression that most physicians out there, I would say the mass majority of the physicians out there, do what they do in their patient's best interest, not their wallet's best interest, not the hospital's best interest, not the um, larger orthopedic group or larger group's best interest, but what's best interest for the patient. And the reason you do and join these hospitals and you join these bigger groups is to get the funding that you might need to make you feel like you can help more patients out with the treatments that you have available. Um, but this was a clear example, and this example happens all over medicine where that physician is sending to you because they don't believe in what you do, knowing that you're going to fail that patient just so they can end up doing a surgery that they feel is necessary, um, which is absolutely crazy, right? And what's worse is if the patient goes through that surgery and does not get good pain relief, the surgeon ends up saying there's nothing wrong with the hardware. Go back to your pain management doctor. So should I message and call that physician back and be like, hey, why is this patient coming back to me? There's nothing more I can do because you did the surgery, so why don't you take it? No, that's not what we do in medicine. That's not what we should be doing in medicine. That's not how we should treat patients. And honestly, that's not how we should be treating other physicians. When he called me, I was very, very upset, um, both emotionally, and I was angry. I was sad. My ego was upset, because my intention was to do the best possible thing for the patient at that time. And I don't think surgeons, when they make these phone calls, realize that. When you belittle other physicians and call them inferior without calling them inferior, it's absolutely insane. Um, it's not just in this field. It's the same thing in sports medicine, where a lot of the trends are going for patients that have, we'll say, an ACL tear, a clean ACL tear, without other damages to the bones or the ligaments significant, and you're not a high level athlete and you're not a young athlete, we don't necessarily need to do surgery. Physical therapy might be all you need and get you functioning again and moving again. Um, but the orthopedic surgeons, on the other hand, are really pushing for more and more surgery. There's been about a 34% increase in total knee replacements, in the past 5-6 years, maybe 8 years. I forget exactly what the number is, but that also increased the dissatisfaction rate up about 30% in the same time frame. Over 50% of patients that have back surgeries will come back and say they wish they didn't have their back surgery. Um, and this isn't me trying to belittle the other way around. I wish that these conversations were had more, and I wish patients understood this more. Um, I honestly believe that this physician thinks that he was doing the best thing for his patient, but now we don't have that opportunity to go back and tell that patient what we're thinking. And now, for this example, my reputation is kind of ruined. Granted, it's one patient, but I was absolutely trying my best to do with this patient. I didn't do any damage. I didn't hurt the patient. Um, the patient didn't get the relief that they wanted. In fact, their pain scores went down, and their ODI, their Australian Disability Index, went down as well, which are both positive signs that the procedure actually worked. It just didn't work for the fact that what they wanted them to work. And by the way, a lot of us pain doctors now are checking everything on ODI scores, not only because the government wants us to, but we want to track our own data to show that what we're doing is beneficial, not only for ourselves, but for our patients. Not a lot of spine intervention are doing that or did that in the past. So I think it's going to be a good thing for our patients in the future. And I think the other thing is, and I harp this all the time, and I think everyone that's been following my content agrees, that we have to do the right procedure for the right patient at the right time. If this was something that was way outside scope, that was way inappropriate, then obviously we don't do those kind of things. We send that to the surgeon who's an expert and has expertise in that kind of procedure, kind of surgery. This was a case that I didn't feel needed it, and it was a safe alternative option. And just because it didn't work doesn't mean there's other things that surgeon couldn't do. And I think that's how a lot of these surgeons feel. And sometimes they say, well, if you're so skilled, why don't you do this and you handle the complications? That doesn't make sense to me either. Um, Medicine should be a collaborative team effort in the best interest of the patient. We might disagree of how we get there, but there should be agreement that we have each other's backs. Let's give an example that's outside of this realm, and we'll come back into the interventional pain realm in a second. But if a patient has a severe infectious disease from who knows what, something that's rare, and that patient comes to a general practitioner's office, the general practitioner doesn't sit here and say, oh, well, I'm going to treat everything, and since this is my field of, I'm supposed to treat everything. I'm not supposed to send you to a specialist. No, what they do is they'll send them to the infectious disease specialist. When a rheumatological disorder comes up or a complication from a medication comes up, you send it to the specialist. You don't sit there and blame other specialists. What happened? What happened? What happened? Um, if that was true, then I think neurologists would have the biggest hatred towards all of medicine, because almost everything we're doing is messing up the neurological system between medications and um, our our cardiovascular system that can cause strokes and other neurological deficits. And similarly with the cardiologist field, they would really be blaming a lot of other people, but we don't do that. We play this fine game of, we understand what you're trying to do. We have to deal with the consequences, sure, but we're doing our best we can to help our patients out. Um, this isn't the only place, right? This is happening in other fields as well, as all over uh, the industry. Um, but it's also like a radiologist, for example, might miss something because they're forced to read 10,000 scans a day, and they get eye fatigue and they don't see anything that's grossly bad, and they call something as normal. And then the surgeon goes and posts that on Twitter and says, "This is a big mistake by the radiologist. I can't believe they missed this." It's, why are we sitting here getting mad at the other specialists? You can have your opinions, but that's a time to pick up the phone and learn something. It's not a time to pick up the phone and say, "I can't believe you missed this." Um, especially when it's problems that aren't life or death. If it's life and death and this and that, I mean, you make it clear on that radiological order or that procedure or whatever, that like, hey, you really need to keep an eye on this. I'm really worried about this patient, and you make it clear on these orders. Um, and that's kind of where this whole disconnect, physicians' egos are so fragile sometimes, and myself included. If I feel like I did something wrong for a patient, then I'm really upset. And again, if this physician calls me and yells at me, and especially when the patient's in their exam room, that's so inappropriate, and that hurt my ego, absolutely. um, and there are ways around it, having open conversations, but a lot of times these individuals don't want to have open conversations. They want to say, "I'm right, I'm right, I'm right." And this happens all the time in the surgical, non-surgical world. Like, what's the best thing for the patient? um, Understandably, there's sets of skills that we have, and we should know our limitations. I'm not going to go and play in the NFL tomorrow because, first off, I haven't played football in over 20 years. Second off, I am not nearly at that skill level. I will go I'll go play a pickup flag football game in the backyard. Sure, that's fine. Um, and I'll have a lot of fun doing it, but I'm not going to, go try out for the NFL. It's just not realistic. I know my limitations. Um, and there are some things that I'm have more skill at than other things, and we know our training, we know our lanes. And when we start blurring the boundaries and start getting yelling at one another, this is where not only do the patients lose, but we start losing trust in one another. This physician probably is not going to send me any more patients because of this, and he kind of made that clear when he called me the other day. And I've lost trust in him. I don't want to send him any of my patients. If this is how he acts towards other physicians and this is how he acts towards patients, I have no desire to send him any more patients. So I've already made connections with the other physicians in the area and let them know. And this has nothing, I mean, this has everything to do with ego, but it also has something to do with more of that, because that's not how you handle situations like this. Um, his words were, this is a problem, and this is how I feel about this procedure. And I mean, it was very, and he had no desire to read the data himself of 88% of the patients that had this procedure did not go on to back surgery in the future. There's an over 80% satisfaction rate for these patients with this procedure. And he didn't want any of it. He didn't want to listen to what I said when the patient comes back to me, and I have follow-ups with my patients more frequently than he does. He's like, then, if they're still in pain after your procedure, send them right back to me. Get them in earlier. But that's not the realistic thing. I can tell the patient to call and go see them, but he's not going to get them in sooner. More often than not, that's been the case. So it's been a interesting dilemma that we've had, and this opened up a whole other option of, it made me sit here and think all week of like, what am I doing for my patients? What am I doing the other way around inappropriately, or I think it's appropriate, or when I think another physician sending me, I can't believe that physician did that. I truly believe, like I said, that physicians are doing the best thing that they feel like they can for the patients. And that's my general philosophy of medicine and my general philosophy of things. I don't get a lot of joy and pleasure out of the monetary factor of being a physician. I mean, if that was my end goal, then I would have joined private equity a long time ago, and I'd be doing the same work I'm doing now, but for a lot more money. I want that desire to help patients, and I felt like other physicians felt like that. The same conversation that I'm having with everyone out there right now is happened on Twitter, and I was kind of following that story unfold as well. Training matters, your expertise matters, and we should honor and respect one another's training and expertise at the end of the day. This is likely, in my opinion and some of my colleagues' opinions, that this is kind of what the system wants. They want us to bicker and fight with one another so that they can kind of keep their hands clean of everything, and they stay out of everyone's way, and they can go and work with the lobbyists, make the regulations for themselves, and as they make those regulations, they make the regulations in their favor. Listening to a fascinating podcast about this, about how the telecom communications, they were the ones that worked with the lobbyists to make the regulations for telecom. So essentially, whoever had the biggest paychecks to the lobbyists were the ones making the rules. And it's not the Congress people making the rules. The Congress people go and sit in those meetings with the lobbyists, get the money back, and then. So, yeah. It's just fascinating that there's no curiosity in this world. People don't want to learn. They don't want to do a self-reflection. And anytime that I have a painful, upsetting thing happen to me, I go into this week-long deep reflection of what did I do wrong? What can I do better? But this physician who probably never see this video, I probably have no desire to work with again or talk to. He's not looking at the other way around. I sent him a text and I apologized, and I haven't heard back from him. So these personality things, it's no longer just being a good surgeon or a good doctor. You have to be good to your patients. You have to be good to people. You have to be good to one another. And that's really what this message should be about and is about, is how do we kind of improve the medical industry within ourselves to get the best possible outcomes for our patients, and keep pushing the data and keep putting out good interventions and good procedures and good options for patients that leave them without worse outcomes. So, anyways, everyone, I hope you had, I hope you found this useful and you are getting some benefits out of this. This is actually kind of a precursor to my next video, which will be kind of my manifesto, something I've been thinking and working hard on the past 3-4 weeks. And this week, this deep reflection kind of pushed me to the point where I really, really want to iron this out in the next couple days so I can get this message out there to the people. So I hope you're having a good one. If you have any questions, comments, please drop them below. Feel free to message me. This week, I was lucky enough to have a med student shadowing me. It's been an absolute blast. We've had a lot of great conversations. He's understanding my philosophy of medicine, and I think he's really diving into the PM&R world, and I want to encourage him and encourage all of you to take on the PM&R mindset and how we work and want to work with our patients and one another. So, all right, take it easy, everyone. Have a good one. Bye.